Next, we have our vision panel, and we're very excited about this vision panel, so I would like to ask, with myself, since I'm moderating this one, I would like to ask Dr. Robert Jackson, Dr. J. Maddock, Dr. Marcia Ory, and Annette Ridenour to join us. All right. Most of you by now know these people up here at the table, but I will go ahead and give you quick introductions to our panel, our vision panel today. Dr. Jackson, who completed his internal medicine residency at Baylor College of Medicine and has been in private practice at the Texas Medical Center for more than 30 years. Dr. Jackson currently serves as the chairman of the Continuing Medical Education Committee and the Center for Performing Arts Medicine at Houston Methodist. Dr. Jackson highly values education and mentoring of medical students and residents as they advance through their careers, and they're extremely lucky to have him as a mentor. In close collaboration with Cynthia Pickett-Stevenson, he has helped spearhead the Center for Health and Nature initiative for the last, 3 years or so. Thank you so much, Dr. Jackson. Next, Dr. J. Maddock is internationally recognized for his research in social ecological approaches to increasing physical activity. Dr. Maddock serves as the senior academic advisor for the President George H.W. Bush China-U.S. Relations Foundation and serves on the board of directors for the Texas Health Institute and the Well-Connected Communities Initiative. His research has been featured in several national media outlets, including The Today Show, Eating Well, Prevention, and Good Housekeeping. Then we have Dr. Marcia Ory, who is a Regent professor and distinguished professor in the Department of Health Promotion and Community Health Sciences, and serves as the director of the program on healthy aging at the Texas A&M Health Science Center. She manages many community engagement partnerships and initiatives which consider the importance of environment on health. Marcia Ory is a fellow of several societies, including the Academy of Behavioral Medicine Research, American Academy of Health Behavior, Gerontological Society of America, and Society for Behavioral Medicine. Thank you for being here. And then we have Annette Ridenour back again. She was here recently, so thank you for coming back. Annette has been a leader in healthcare design for 25 years or more. As president and founder of Aesthetics, Inc., she leads in the design and facilitation of healing arts programs that are evidence-based, custom designed for each facility to improve the healthcare experience. Annette has served as principal lead designer to add artwork to many gardens in acute care hospitals throughout North America. The integration of custom designed artwork fulfills the specific intention of amplifying the healing effects of the gardens to be restorative and therapeutic. So thank you so much for serving on our vision panel today. And we're so glad to have you here in really giving us some insight and letting the audience and all of us leave with the right message as we process all the information from 9 a.m. up to now. So in 2 minutes, I would like to ask each one of you to answer this question. And you can think about it for a little bit. I can talk a little bit more. Each one of you, I would like to ask, what do you see in the future of this field? As you have heard everything from research needs, research updates, research proposals, and the real importance of nature in health outcomes, where do you think the field is going? What do you see in the future of this field? Dr. Jackson.
Well, first of all, I want to thank you for inviting me. I'm not sure I have much vision to offer for the panel, but I see the Center for Health and Nature actually being the focal point for research and education and dissemination and testing for how nature affects our health. And I believe that the field is very young, but it's certainly ripe for research and improving nature. When I tell my friends that we're doing research on how nature affects health, they say, well, why do you need to do that? It's almost like a no-brainer. I mean, wouldn't you rather be on a beach somewhere now? Or I was looking at the virtual window and just sort of imagining being up in the mountains of Colorado. But in order to affect policy and to drive change as we urbanize more and more, we need to have research and be able to demonstrate return on investment to the people who make public policy.
Right. Thank you so much. Marcia?
This is our vision panel, and I think one of the most visionary things we did was to have this conference with the amazing people that are here. And early this morning, Joni sort of started off, and I think all of us should be part of that what-if team with all of those what-if questions that you asked as we imagine the future. I actually asked David about if you had a crystal ball. And I think if I had a crystal ball, and it's really hard to imagine the future, but what I would say is we no longer have to prove that nature has an impact on health. But there are so many nuances, and that's why I think we're here, is to understand, to identify, and then act on those nuances. And so I heard a bunch of what, hows, and what, and wheres. So certainly it's the what. It's being able to define what aspects of nature that we're talking about and the dosage, how much of that nature. It's the what are we relating it to, and we see that there are differences depending upon the what. It's the for whom, and I think we'll talk more about how the impacts are different in different settings and for different people. It's also, and people here talked about, and we need more attention to the how. What are the mediators that are linking the health and the nature relationship that we see? And then I heard a lot, and I think we too often just look at one point in time, so we need to look at long-term impacts. But as a public health professional, what I would say the most important thing in my visionary statement is going from research to practice, is to sort of not just say that we keep needing more research, but what can we do? And for that, I think we need a bold initiative. We need bold leaders. And already here, we've seen some of these bold visionary leaders. And then we need to ask ourselves what each of us can do. What can we do as healthcare professionals? What can we do as design people? What can we do as healthcare systems? And what can we do as communities at large? Thank you.
All right. Well, I'm really excited about this. I've been working in physical activity since the late 90s, and it strikes me the more I see this, how this field today looks like where physical activity was mid-90s. And one of the first things, 1996 was the first recommendation of 30 minutes of physical activity a day. And I like Florence's chart of the different levels of exposure to nature. I think right now they probably look a little bit like the 10,000 steps recommendation, where they sound good, I could take that and believe it, but finding the evidence behind that is how much nature do we need, and then how do we get people out in nature? And I think one of the biggest things for me, being a behavioral scientist, is we had a lot of presentations from epidemiologists today. And one thing epidemiologists do is they tell you, oh, physical activity is good for this and that and the other thing. And I know when we come back a year from now, they're going to tell us nature is good for this and that and the other thing. And that evidence is going to keep accumulating, which is wonderful. But I think we don't have the time to wait until all the evidence comes in. I'm convinced enough that we need to expose people more to nature. And so I think we really need to look at how do we increase the amount of people. I mean, the effect of sedentary behavior and devices is pervasive in society. Every year, screen time is going up and up and up. And this is studies reported by the media, not by researchers. And they know we're getting more and more screen time. I have young children. If anyone has young children and has experienced Fortnite, it's evil. And it eats kids alive, and it's like you can't get them outside. And so, we're faced with this really strong path to keep kids inside in front of devices because the media can make money on them. And so I think we need to really shift that. And I'm so excited to see a lot of the people here that have been working on increasing access to nature. And one thing we know in physical activity is if we increase places for physical activity, it only works if we do promotion along with it. And that's in the community guide. And I think if we did nature, we'd find the same thing. So I'm really excited about this field. I think we're going to see tremendous change in the next couple of years.
Thank you, Jay.
Well, I'd like to speak from the place where I live, which is design of acute care hospitals and health centers. What we have seen is that patient outcome studies and patient experiences have really guided senior leadership to want gardens in all of the hospitals. And so I see it pervasive. In the dozen projects I'm working on in North America right now, there's 1 to 5 gardens in each of the projects. What I see as a vision for the future is that the senior leadership changes its consciousness, not just to say we want gardens, but we want gardens why. We want gardens that are very specific and therapeutic for specific health outcomes to specific patient populations. I'm very fortunate in that, all of the gardens that I have been involved in design of have been very specific to different patient populations. The very first garden I was asked to design was a 12-step garden to be built in a rehab center, and in which we created 12 little mini rooms in which each of the rooms had artwork that specifically engaged the participant to have a deeper understanding about the step. And then the second garden that I was involved in was inspired by families in a children's hospital who wanted a place to pull the plug and have their children die surrounded by nature. That's a very, very specific environment, a very, very specific healthcare environment to design. So what I see coming out of this amazing symposium is more research, and the research that will inform more prescriptiveness so that there will be more intentional gardens, and this synergy will happen between the medical community and the landscape design community to really work on intentional gardens.
Wonderful. This is really promising, hearing a healthcare designer telling us we need more research, and the researchers telling us don't wait on research, we need practice, implement. So I think we're going somewhere with this. So thank you for your comments. Let's move on and talk a little bit more specific about what you see in this line of research and initiatives in terms of health outcomes and impact on health on different populations. And I know Dr. Jackson can talk to this in terms of different disease categories and patients. We have an aging researcher, a physical activities researcher, and a healthcare designer. So let's talk about which populations we should be focusing on.
Well, I'll speak to cardiovascular disease because it's the #1 killer in the world. I mean, we talk about the United States because we're sort of American-centric, but 18 million people die every year of cardiovascular disease, and that represents 1/3 of all the deaths in the world. And about 85% of those deaths are from heart attacks. And so my new superhero is Dr. Bhatnagar, who published in the recent article in the Journal of the American Heart Association, and he and his colleagues were the first to demonstrate physiologically what the health benefits of green space in the area that they were looking at. And they looked at patients with moderate to severe cardiovascular disease risks, and the more green that you lived closer to, your risk began to drop. And so I like I say, you're my new superhero, and I think that kind of information we need to take to our policymakers and say, listen, you plant a few trees, you reduce some heart attacks and visits to the emergency room, the return on investment is going to be enormous. So I think, of course, you know, the Houston Methodist Hospital, the Methodist DeBakey Heart Center is focused on cardiovascular disease, but the spin-offs are just enormous, just being close to nature and having more green space. So thank you for all your research that you did. It was just published a couple of months ago, hot off the press.
Thank you.
I take a life course perspective that it's important what you do and where you live and nature at every age, but I'm particularly interested in older populations. How many people know that by 2030, 2035, there are actually going to be more people in the U.S. that are 65 and older than kids under 18? So we are an aging society. And I think when we think of environment and nature, I think there's a particular impact on older people, on people with physical and mental deficits. So in addition to being interested in older people, I'm interested with people with the increasing numbers with cognitive impairment. There's a movement that I particularly like, and it's called 880. How many people have heard of 880? It's sort of designing the environment to be safe and fun for people who are 8, but also for people who are 80. And it's really this concept of universal design, thinking of everyone in the community. The other thing I would say is there's a huge movement toward age-friendly cities. How do we make cities more, that older people are able to navigate them better, to be outside more? But we also have this parallel issue about dementia-friendly communities. And so the question that we're asking, I'm answering it with Chanam and others, is what is it about an environment that is activity-friendly? What are the things that are similar or different if you have cognitive impairment? Nature is wonderful, but if you're somebody who wanders, is nature going to be wonderful or is it going to be safe? So I think we need to look at individual populations and what their needs are.
All right. I guess, it starts back when I was young in college working at a summer camp for inner city kids, and it was out in the woods, and I had a bunch of kids from 10 to 12 years old, and most of those kids had never been in the woods before. And this is 1995. Like, it's worse now, and it's amazing how people don't have exposure to nature. And we think it's a natural thing. We think people do it, and the kids had never seen the stars. The sun went down, never seen the stars before. So that struck me. And then, professionally, my research has been a lot in parks. And so back when I was in Honolulu, we did a study of parks throughout the island in high and middle and low-income communities. And the data came in, and it showed that the people were most active in the low-income communities in the parks. And I said, that surprises me. So we looked at the data, and we found that those parks were used at 10% of the parks in the high-income communities. People didn't linger in those parks. They jogged through them, they might play basketball, but there was no sitting and enjoying the natural environment because of concerns for safety. We actually had a dead body show up during our observations in one of the parks, which probably didn't help. But this is the reality people are living with, is you can build parks in neighborhoods, but if people don't feel safe, they're not going to access the green space, especially if it's densely wooded and you can't see where in a hiking community people feel safe and they're going to be there. So it's kind of a striking difference.
I think there's two patient populations. People with disabilities really are very handicapped at getting out into nature. I travel with my sister-in-law in a wheelchair, and we go to the different national parks every year. And it's good, but it's not good enough. We really have not made enough accessible pathways into the green areas of our parks. And I think this is something that we really need to, concentrate on making this more accessible for them and the elderly. The other area where I live every day is with children in hospitals. Gardens in hospitals bring a certain sense of normalization to the whole family. If you have a child in the hospital, they may be there for weeks, sometimes a month. And so there needs to be play areas for siblings to be able to be with the other parent while the one parent is spending 24/7 with the child. A great story I have from one of the gardens that we worked on in a cancer and oncology unit. The parent is always so busy in terms of the care. Please eat, enough rest. Gardens offer the opportunity of storytelling and getting out into an environment where actually the parents and the child can actually have a conversation about things other than the illness. So it brings all kinds of dimensions of remembering that these are really children into the picture of improving their health.
Great, thank you so much. Great answers. Many populations to consider. Thank you. We heard a lot about equity today from many of our keynote speakers, and we're quite aware of health disparities, especially as public health researchers and science of medicine and physician scientists. We often are quite occupied with reducing health disparities. How do you see nature's role in reducing health disparities? Whoever would like to start. It doesn't have to be Dr. Jackson. Health disparities can be.
I think that, the whole kind of concept of this meeting and our work is that nature is important for everyone and there should be access for everyone. And I think the key is, what is the minimum amount of access or nature to get a maximum benefit? So I think when we're talking about equity, we could talk about the $10 million that are spent in Louisville for trees, or we can think about what can be done on smaller spaces. And so if we think about, Ed Jones, you mentioned your brother with an orchid in the room and how meaningful that was. Or if we think about Japan and places where space is at a premium, you don't have to have a huge amount of nature, but just a very small amount of nature. So I think we need to consider how it is that we give more people equity. The last thing I would say is I think access in safety is often subjective versus objective, and we've heard that before. A place may seem safe to others, but not to you, or vice versa. I'm with a project called Healthy South Texas, and there are parks there, but people don't go. It's sort of what Jay just said. Sometimes people don't go to parks because they're gangs or they don't feel safe. So in that case, the increased access to nature is the community taking that park back, getting together, cleaning it up, getting rid of the graffiti, and actually monitoring their parks in the same way that we have home watch. I think we should have nature watches too.
Yeah, I think this is one of the areas that's probably the most important to what we do, because for anybody that's worked in walkable communities, we know that when we build walkable communities, the price of housing goes up. And I think the same thing is going to happen. The more we integrate nature into new developments, the more it's going to cost. And so we really run the risk of gentrification through nature. And people are going to want these environments. People do want these environments. And so I think we need to be really careful and say, how do we do this? I think our schools, or certainly one place, public schools in America, are still one of the places where we have access to everybody, and getting those kids out into nature. I love Florence's picture. My kid went to a preschool that was very friendly to that, and I'd find my son about 6 feet up in a papaya tree when I pick him up, which is nerve-wracking, but having that experience and a public school was such an important thing to give them a love of nature. And I think if we can do that with our kids, it's a way to create access across the country. In
every city, there are marginal urban environments where Neighbors have gotten together and they have built community gardens where they're growing vegetables. We have seen a revitalization of each of those communities based on people getting together and learning how to grow vegetables. And I think it's a wonderful, these are wonderful projects for the renewal of our cities, and this is something we should actually do research and do more support on.
I'll speak to Houston, Texas, because we have two very large parks here, and I go to both of them. One is Memorial Park, which is very, very nice, and mostly middle to higher class, higher socioeconomic class people you see there. And then there's Herman Park, and on the weekends it's full of people of lower socioeconomic class, but both groups are enjoying those parks. And if you believe that being in a park for a certain amount of time improves your health, what Houston needs to do is build more parks and more green spaces. And I don't see any disparities in either one of those parks about people enjoying being there. If you go to Herman Park on a Saturday or a Sunday, it is full of people. It's wonderful to see. And the same thing with Memorial Park. So we need more parks, we need more green spaces.
Great, really insightful. Very great comment. Walkability to a park seems to be the measure. It looks to me here. So thank you so much. We have the last question for you, about 30 seconds. If you could tell us, what would you like the audience to walk away with? What is the message of this symposium, or what is your message to us?
So my message is what Cynthia Pickett Stevenson tells me every weekend: go out and take more nature pills. You can't overdose on nature pills.
My message is the time is now to act. And I think we've all been to this conference. We've been here since 9. And I challenge everybody to think of one thing you can do. What difference can you make to strengthen this relationship between nature and health? Whether it's something that's going to be research or practice or policy or education, the charge is promise yourself you'll do at least one thing. I'm going to do one thing.
I'm just jazzed. We've got scientists, we have physicians, we have environmentalists, activists, journalists, the First Lady. If we can't start a movement with this group, we can't do it. So this is the time, right? We got the people. Let's make it happen.
That's exactly what I was going to say.